Hey folks, welcome to Tully River Quail. I'm going to give you a little tutorial here on the TRQ method of treating bumblefoot. One of our gals got some bumblefoot on her old toes there, so we're going to be been treating her for about a week or so. We got another week left, but just want to go over what we did. We have her separated and isolated in the cage because bumblefoot is a staph infection from a cut or an impaction from dried food or dried poop. And so we have a cage that's lined with cardboard that doesn't have any mesh or metal for her to get screwed up on. We changed that material out, plus I have some bedding in there. You can see a feeder and a waterer, and she stays in this for a couple weeks. What I'm doing here is I have a bath of Epsom salt water, and I'll take a jug and use some warm water with half a cup of Epsom salt in there, and I shake it up until it's dissolved. I put it in the bottom of here, and I have a drawer liner on the bottom just to give her some footing and just enough to bathe her foot. So I'm going to take him out. I'm going to show you that the medicines that I use. I'm going to rinse it first with some hydrogen peroxide. Then I have some triple antibiotic ointment and some gentamicin. I alternate which one I put on first. The gentamicin is specific for E. coli bacteria, poop bacteria. So some days they get the triple antibiotic as the first layer and the gentamicin. Today it's a triple antibiotic first, then the gentamicin. So I also use some WedRx as a rinse and some hydrogen peroxide. So I'll take him out. I'll dry him off a bit with a clean towel and squirt him with hydrogen peroxide, dry him off, rinse him, dry him off, put on some Vederson, dry him off, put on the antibiotic stuff, and then he goes back into the cage until tomorrow's bath. We try to do this 3 times a day. So here we go. I'm going to take him out, or her out, I should say. What's up, babies? Now she's been doing this for the last couple days, but you can kind of see her foot. It's getting better. You know, it's pretty beat up there for a while. So I'm going to dry it off here, get it rinsed up. Each day I soak it for about 20 something minutes. And she's kind of used to this now. So just to clean it, I use the hydrogen peroxide. Then I just drop a little water on her. Now I'm doing this in the middle of February here, so obviously if it's cold, you're going to want to do this inside. We just happen to have 60-degree weather. So, and here's this Vederson. It's an antimicrobial poultry care. Get that at Harbor Freight, or not Harbor Freight, Tractor Supply. Just a little squirt. This is good for birds that may have an eye injury or something like that, because it's okay to use around the eyes. And sometimes I'll take a warm towel, and some bird will be blinded for a little bit. I can put the warm compress around her eye until her eyelids separate or open back up. We've had good success with that. Okay, so she's been antimicrobed. We're going to put this gentamicin on here, and that's going to keep it soft and let her heal and get rid of any poop type bacteria. And then this extra layer of the triple antibiotic I'm going to put on, just because we don't really know what's going on in here, what's causing the inflammation besides maybe a staph infection. So we're going to treat them both. And she's happy. Now I'm going to dry her off a little bit. She's been in there for 20 something minutes, so she's kind of a little wet, and she likes it when I care for her a little bit. So, and if you can see on the inside here how I have that, now I'll take that out and put in some new water, but I have a little drawer liner in there just so she has some footing, and I'll rinse and clean that and put in a new bag of warm water, or a bucket of warm water for her with the Epsom salts. You can get Epsom salts at any drugstore. Okay, ready to go back home for a little bit? All right, baby. Well, that's it. Hope that helped you a little bit. If you have that, it's best to treat it as soon as possible. And as always, stay free.